Hello and welcome to Addressing the COVID-19 Crisis, our weekly open forum series for pharmacists, pharmacy technicians, and student pharmacists. Welcome. I'm Michael Hogue, the Dean of Loma Linda University School of Pharmacy and the President of the American Pharmacists Association. We are so glad to have you with us today. We're talking about a subject that I think all of you will find quite interesting. As many of you know, the Department of Health and Human Services has now authorized nationwide pharmacy technicians to have expanded roles in immunizations and COVID-19 testing, and there are a lot of questions that surround that. So we thought today we would spend our program time discussing what's really happening on the ground and make sure that your questions are answered about pharmacy technicians and their role in the team as we address the COVID crisis. Now, joining us today will be two experts in this area who've really taken the lead in their areas as it relates to pharmacy technicians. We'll have Dr. Kim McKernan joining us. She's the director for the Center for Pharmacy Practice Research and an associate professor in the Department of Pharmacotherapy at Washington State University College of Pharmacy and Pharmaceutical Sciences. She graduated with her Doctor of Pharmacy degree from WSU in 2008, and she joined the faculty at WSU in 2013 after 5 years in community pharmacy practice. And she's been very involved with pharmacy technician training as it relates to the topics that we're sharing today in immunizations and testing. We also are glad to have with us our Linda Newcomb, who's a certified pharmacy technician and member of the White Mountain Apache tribe in White River, Arizona. She is currently employed with White River Service Unit, Indian Hospital, and has worked with them for over 13 years. She received her immunization training at Washington State University and has been vaccinating patients 3 months old to the elderly since 2018. She's engaged in community outreach with the WRSU Pharmacy Community Outreach Immunization Team and has helped with COVID-19 testing by doing swabbing and tracing, and did home visits with COVID-19 patients to assess their oxygen levels. So we're very excited to have our Linda with us because she has this frontline experience right during the COVID crisis. So I'm sure many of our listeners are at different stages of implementation, and our Linda's already walked down this journey and can share her experiences. As we always do, we have our experts from the APhA staff that'll be here to answer your questions about COVID-19. We're not just on today's subjects, but anything related to COVID-19, and we've already had several submitted. So we know we'll be hearing today from Dr. Dan Slott, who's Senior Vice President of Education and Business Development at APhA, as well as Dr. Elisa Bernstein, Senior Vice President of Pharmacy Practice and Government Affairs at APhA. And as many of you know who join us weekly, Elisa joined us after a 30-year career with the Food and Drug Administration and as working a part of HHS. Today's subject, of course, Elisa will have great insights into as well. We're also delighted to have Mitch Rotholtz joining us. Mitch is the Chief of Governance and State Affiliates for APhA and the Executive Director of the APhA Foundation. Mitch is a career-long expert in immunization practice and does a lot of advocacy work on behalf of our profession in the field of immunization. So we're delighted to have Mitch with us as well. Well, we've got a lot of material to cover today, but I want to give you all a little bit of insight into what we're covering and how we're going to do it. As we always do each week, I'll do a bit of an interview with our two guest panelists today, and then after that, we're going to open up the lines for your questions and to be able to answer the things that are burning on your mind. Now, today, the way we handle questions is that, as you'll notice in the GoToWebinar control panel, you can actually enter in your questions in the questions box. Type those in as you think about them. In fact, if you came to today's webinar with questions on your mind about pharmacy technicians or any other subject related to COVID, you can go ahead and type those questions in now and get them in the queue so that we can work them into the program as we go along. If you have the ability to speak and ask your question verbally, then when we come to your question, I'll call on you by name. The APhA staff will unmute your line, and then you'll be able to ask your question directly and verbally of our panel. Now, just a couple of reminders on the GoToWebinar control panel. If you're joining us using computer audio, there's a little microphone icon up there. When they unmute your line, you'll want to click on that and make the icon green. That'll show that you can actively speak. If it's orange, it means you can't speak, that your audio is muted. Second of all, if you're joining us by cell phone or a landline, you'll need to put in your audio pin into the GoToWebinar box now. So you'll need to go ahead and enter that into your phone, the GoToWebinar pin number for audio if you want to be able to speak. Now, you don't have to say your questions out loud. If you would rather that I ask the question on your behalf, just type the words "no audio" when you ask your question, or Michael asked this question for me, and I'll be happy to make sure your question gets addressed. We'll take all the questions we can today in the hour that we have allotted for us, make sure that you have the information that you need. Now, today's webinar is being recorded. We post the webinars usually within 24 hours at pharmacist.com in the coronavirus resources section of the website. And you can then listen to the webinar from today, and you can share it with your friends who may have not been able to be on today. In addition, the handout is available in the Handouts tab on the GoToWebinar control panel. You can click on that now and download it to your computer. All of the links in the handout are active and will take you directly to the resources that we're talking about today. That will also be uploaded to pharmacist.com in the coronavirus resources page for future reference. So encourage your friends to go there, and you can always go back and listen to any of our previous episodes that we've had. We're well over 30 episodes of the show that we've done, weekly webinar series, and we hope that you've enjoyed it, and you can always go back and reference those materials previously. So at any rate, I want to now invite our two special guests, Kim and Arlinda, to please join me on screen. Kim, Arlinda, it is fantastic to have you with us today. Welcome.
Thank you.
Arlinda, welcome to you. We're glad to have you with us, and I'm going to get started. Kim, we're going to jump in with a question for you first. And I want to reference that I've got a slide here I want to show, Kim, before you get started. I mentioned HHS's authority, that the Department of Health and Human Services has given some authority, and I'm going to leave this up as a reference for our audience while you speak in this first question. In some of the practices that are out there, and I think you've done a lot of training of technicians, technicians have been engaged in vaccine administration in your state well before these HHS authorities authorized them to administer the childhood and the COVID vaccines. But technicians have not always been able to administer vaccines. So how did we get to where we are today? Maybe you could give us a little bit of the history, since your state has a lot to do with that.
Yeah, I'd be glad to. And so some of this took place in the state of Washington, and then also it was actually the state of Idaho that was the big player early on in this. So my involvement started in 2016. The director of the Idaho Board of Pharmacy at that time, Alex Adams, was looking at changing the administrative rule, allowing technicians to immunize for the first time in the United States. So he reached out to me about creating a training program specifically for technicians because I do quite a lot with the immunization training. So he reached out to me about that, and we did a pilot project. So we wrote an accredited training program, really focusing on the pieces of immunization training that we thought were most important for technicians to learn. And then we trained 25 technicians in the state of Idaho. So this was December 2016. And then we thought, nobody really knew exactly how this was going to go. So we decided to track it, see what happened. And we were thrilled that between December, when the techs started immunizing just these 25 technicians, and May, they gave, it was 953 immunizations, just these 25. And we didn't have any reports of major adverse events or any concerns that were reported to us. So I was thrilled with the results of that, and it's all kind of built from there.
Well, that's quite a great accomplishment, I tell you. That's putting action to training immediately, it sounds like, in that case. Well, Arlinda, you were clearly one of the early pharmacy technicians to be involved in administering vaccines. one of the very first technicians in the federal system who was trained. Tell us a little bit about your experience. We'd love to hear just a little bit about your experience. Arlinda, you're muted. I'm sorry. Can we get you to unmute there? Thank you.
Sorry about that. Well, I really love it. Thanks to Kim that was making it all possible for us to immunizations since 2018 to currently I did over probably like 2,000 patients since then, from 3 months to elderly. So it is a beneficial to everyone, especially coming from a pharmacy tech experience. So I really enjoy it.
Well, that's great. I mean, let me just ask kind of the scope of vaccines. You're immunizing 3 months all the way up to the elderly. I mean, are we talking about every vaccine that's on the market pretty much that you've administered at this point?
Yes, according to the CDC guidelines, we pretty much go from what the kids needs up into the elderly to Shingrix to the pediatrics. So we do everything through the CDC guidelines.
Wow. Well, I'm going to have us move to the next slide, because on the next slide, there's a little bit of discussion here about the training requirements that have to be met for pharmacy technicians related to the practical training. And of course, that's what Arlinda has talked about, and Kim up to this point, is that Kim and her organization created some training, and Arlinda is one of those technicians that went through that training early on. And so that's fantastic. There's some additional requirements that are listed for folks' reference on the slide here. I'm wondering, what recommendations do you all have for how pharmacists and technicians might most effectively work together? And Arlinda, I wonder if you could just share with me, I mean, you're administering these doses, but how are you working with your pharmacist and in tandem? How are you working as a team?
Well, the way we screen, the patient comes in, then we ask them if they want to get updated. Then the pharmacist do a background check on them and their screening, and then we get the vaccines ready for them, and then they oversees us how we vaccinate them, administer the vaccines to them.
That's great. So it really is a team. And Kim, maybe you could talk a little bit about in the training how you sort of help pharmacists understand the delineation between what the pharmacist does and what the technician does.
Yep, I think that's a hugely important part of this for both pharmacists and technicians who are interested in this, to understand that as we were looking at this, really the whole process of immunizations is divided up into tasks we would consider clinical tasks, so clinical decision making, and it is still absolutely the role of the pharmacist to do these pieces. So making sure that this vaccine is appropriate for this patient, doing all of the screening, all of the counseling, answering any questions that the patient has, that is all still the pharmacist's responsibility. Where we're looking at the more technical tasks, you know, administering an immunization, administering the injection, which is absolutely something a technician can do, and we've seen great success with that.
So Kim, just to be clear, you know, this new authorization not only allows pharmacy technicians and pharmacy interns to administer vaccine, sort of override state law, so to speak, to allow that to happen nationwide, but it also authorizes pharmacists to prescribe these vaccines. And, you know, tell us about the significance of that. What had to be done at the state level prior to this, and then after this? What's this whole idea of ordering or prescribing vaccines? What changed here?
Sure. So that's absolutely something that has been state specific historically. You know, we have 50 different states with 50 different sets of rules around our Pharmacy Practice Act. And so what we found is that there were states that are actually already more progressive than what's allowed in this act. They've already been prescribing and administering vaccines to, you know, the whole spectrum of ages with the spectrum of vaccines. And there are a lot of states where, you know, these are huge changes for them. So I think it's something we're going to need to look at through this whole process, is what did the state allow before, and how has that changed? I know this is going to create a lot of change for pharmacists in a lot of states, particularly around administering immunizations to peds, because I think that was something that was a limitation in a lot of places before.
Yeah. So Arlinda, in your federal facility as a pharmacy technician, you're under the supervision of a pharmacist, I would assume. When we say you're under the supervision of a pharmacist, I mean, is a pharmacist literally standing right over your shoulder the whole time, or are they ordering the vaccine and then you're going over, say, to a private area to administer the vaccine? Is the pharmacist with you every step of the way? What does that look like just from a logistics standpoint? I think you're
It's
muted
both.
again. Oh, there we go.
Oh no, it's both because we go into like out in the community, they're right there at the people that come onto the table. We have a section. We pretty much just screen them. They're right there, making sure we have the right dosage and the right patients, and then they're just standing right there observing. But with the COVID, we go out to the vehicles, and then the pharmacist is standing next to the vehicle with me on that part too.
Okay, all right, that's good. Kim, do you have any advice on this? I mean, there's some question, of course, that says that pharmacists, you know, state law says that pharmacists, pharmacy students and technicians need to be under the direct observation or need to be observed by a pharmacist. So what is your take on that? I mean, does that mean that the pharmacist really needs to be present in the facility? Would it be, and I'll just kind of add on to this, would it be acceptable, for example, for a pharmacist to order the vaccines and send a group of technicians into a facility where the pharmacist is not present? What's your thoughts about that?
Question. Yeah, so I think when we're trying to consider what does supervision mean with pharmacy technicians, interns are a great example. In most states, pharmacists have been supervising interns with giving immunization since back before I was a student pharmacist. So we have a lot of experience, most of us as pharmacists, knowing with interns what we do. And usually, at least in my experience, that means when the intern is a new immunizer, I'm going to be right there next to them, making sure everything is fine as they get started. And then as they get more comfortable with the concept, and I, as their supervisor, get more comfortable with the idea of them immunizing, you know, that might mean I'm standing in the pharmacy and I'm looking into the immunization area, but I might still be, you know, in the pharmacy area. So I think supervision wise, really it comes down to kind of the comfort level of the pharmacist and the technician both. With many of the technicians that I've worked with, early on, they really wanted a pharmacist right next to them watching. And then as they got more comfortable, you know, they were happy to step into the immunization area themselves and take care of it. So a pharmacist still absolutely has to be supervising them. In my mind, that would mean I would not send, you know, technicians into an area that I wasn't at least nearby. I'd want to be ready to help them deal with anything that came up. You know, we rarely see these anaphylactic reactions to things, but they do happen. And I'd want to be right there making sure I was ready to take care of that.
Arlinda, I would say, I'm just guessing here that, you know, the good feeling that as a technician administering vaccines that you must have in knowing that you're preventing illness and that you're an active part of saving people's lives, that just got to feel great, I would think.
It sure does.
Yeah. So, you know, tell me about how being able to administer vaccines and conduct COVID testing as a technician has changed your view of pharmacy, and how has it changed your career thinking?
If I enjoy just being out there for the community because on this reservation we're isolated, but then it's just providing and being preventative, providing the care to the patients. And especially since COVID hit, it just makes it harder for patients to come to the hospital, but us being in the community, that makes it known that we are still providing the care they need.
That's great.
From
Yes.
vaccine to the testings and everything.
Well, I tell you, Arlinda, you're one of my heroes, because we've seen during this COVID pandemic that our Native American population has been disproportionately hit with COVID and has seen a large number of deaths and a large number of serious illnesses. You know, that I just think it's a wonderful thing that you're doing the work that you're doing, and I commend you for it. Now, I want to talk about children for just a minute. Okay, so even pharmacists in a lot of communities have not been very accustomed to immunizing kids, but you do actually have that experience, Arlinda, and Kim, you may well have that experience too. I don't know. Tell us what's different about immunizing children versus immunizing an adult. Can you give us some practical tips on that? Either one of you or both of you, give me your thoughts.
Sure. So I'd be glad to jump in with this one. Although I know Arlinda has a lot more experience immunizing the kiddos than I do. Done amazing work. I would say one of the hardest things in my mind is just that, you know, in general, I love children. I don't like to hear them scream. I don't like, you know, for them to be crying. And with adults, you tell them you're giving, you know, them a vaccination, and usually they sit there and say, okay, and they might say, ow, and then it's done. But with the kiddos, they get upset. And I feel like, to me, just it hurts my heart a little bit, you know, every time the kiddos squirming and crying. But we also know that what we're doing is hugely important and is keeping them healthy. So that, to me, that's the big difference, is just the behavior of the child.
Arlinda, what other tips do you have for pharmacists and pharmacy technicians who are going to immunize children to be aware of?
It's best to have another person there with you and have the parent, and then you just guide them how to properly secure the patients, because the infants are okay, but it's just the toddlers that tend to be squirmy and everything. So once you have a secure position for them, and then it kind of makes it easier. But after a minute later, they just look at you and quit crying, and sometimes they just tell you that didn't hurt, and you're just surprised. Some of them are just surprised though.
Yeah. So Kim, I guess when you do these training programs, you must teach pharmacists and pharmacy technicians about how to successfully secure a child in order to give these immunizations. Is that right?
We do. So we have it's called a comforting hold technique. So basically a way that you have the parent or guardian, and there's a couple different ways depending on how old the child is. But yes, we teach pharmacists and technicians how to teach parents or guardians how to hold the kiddos, and that's hugely helpful, making sure that everybody's involved there too.
Yeah. So it's really great thing that's going on here, I think, with pharmacists being involved in technician training, and also in technicians being involved in both testing. Now, we really haven't, Arlinda, talked a lot about testing. So I've spent most of my time asking you about immunizations, but you also have a good bit of experience in conducting COVID testing. And my guess is that a lot more of our audience today has experience with technicians doing testing, just based upon what I've seen happening in our local community with our community pharmacists. So, you know, when COVID testing came along, how did you come up to speed on how to do the COVID testing? Did your local pharmacy there bring you up to speed on the technique for doing testing, or how did you learn that?
We have a team of IHS contact tracing, so it consists of the public health, and then they add up more departments to it, and then once they had the competency, but before you literally had to do it, they had to pass the competency, and then from there you went with another person to do it.
Sure.
So it was a learning experience, but we had to done up and done down too for each patient that we tested.
Yeah, so IHS basically did training that taught donning and doffing of personal protective equipment, and then the testing methods, and you practiced with someone else first before you actually conducted it on a patient. I thought that's a great idea that you said, you know, you had someone else go with you the first time, so that someone who was more experienced could observe your technique the first time you did it. So that's really great. That's good information. Well, we are getting tons and tons of questions in the question box from our audience, and I don't think we can hold the floodgates back any longer. We're going to have to take some questions from our audience. And so just as a reminder, folks, if you have questions, type them into the question box. If you don't have audio and you want me to ask the question, just say no audio. If you do have audio, then we'll call on you to be able to ask your question. We're also going to take questions now on any topic related to COVID-19, not just the current topic. I think I'm going to ask Elisa Bernstein to join us right now because we're getting several questions about federal authorities and about legal issues. And I think we'll, rather than putting Kim on the spot or Arlinda on the spot for all of these, I'm going to put Elisa, who's a pharmacist and an attorney, on the spot and let her answer some of these for us. The first question, Elisa, is are pharmacy technicians required to complete blood-borne pathogen training to meet OSHA standards? Was that mentioned in HHS, or is it expected that pharmacy technicians, of course, would meet OSHA standards? What's your thoughts about that, Elisa? You're muted, I'm sorry.
Sorry about that. Very good question. The HHS authority did not specifically mention this. What for a technician to be able to immunize under this authority, they do need to either be registered or licensed by the state or have a certified technician certificate. But in addition, the only other requirement was having hands-on ACPE training with hands-on injection experience. It does include a clinical evaluation of the indication and contraindications and a bunch of other things, but it did not specifically mention anything about blood-borne disease.
Yeah. So, and you know, Kim, I don't know how you've approached this with trainings, or Arlinda, how you've approached it, but my take on this would be that OSHA regulations are in place and they apply to all clinicians that are involved in handling bloodborne pathogens. So I would expect that there would be an expectation by OSHA that everybody who has potential contact to bloodborne pathogens would complete that training. So that would be my approach, fairly conservative and risk-averse approach to make sure we comply with OSHA regulations. Arlinda, have you gone through OSHA training? Is that something IHS requires, bloodborne pathogen training?
Yeah, we do. We need to do our yearly competency with the yearly training. So that's one of them that we have too.
Okay, all right. And Kim, do you put that as a part of your program as well, I would assume?
Yeah. So that's the expectation, is that that would be done externally to the technician immunization training. Although we do touch on that quite a bit at the beginning, because really anybody who's handling, you know, needles, immunizations at all should be reminded of what's going on with those pieces.
Yeah. So Dr. Larry Selko has asked a question that he doesn't have audio, but I'm going to ask his question for him. Many pharmacists carry their own professional malpractice insurance, even if their employer might provide insurance that covers them, but some pharmacists carry their own as well. Would technicians be advised to carry their own liability insurance under this emergency authority, or are there protections that the federal government's providing technicians here? So, Elisa, maybe you could give us your thoughts on this. What's the liability associated with pharmacy technicians doing testing and immunizations?
Yeah, the authority that HHS granted is actually really the crux of it is immunity from liability. So there is protection there, though to the extent that having own backup insurance and other insurance as well is always a good safe thing to have. But for this particular activity, for immunizing or testing for COVID, you are protected under the PrEP Act.
Okay, covered under the PrEP Act. So the one exception there would be, of course, a negligent act. So if a pharmacy technician didn't have appropriate training, they could potentially be liable there. But even a pharmacist liability insurance policy or a tech liability insurance policy is not going to cover your negligence. So you got to be trained and you got to be prepared. So that's great. We'll take Murti Savatala. Dr. Savatala, we welcome you today, and we're going to unmute your line and let you ask your question.
Okay, I just want to know if the boards of pharmacy have to be individually, each state has to certify them before they are authorized to provide immunizations.
Okay, so, Elisa, tell us, what if you're in a state that doesn't routinely register or license technicians? Does that process have to happen first before technicians can be involved?
Yes, you have to be either licensed or registered, and if your state does not license and registered, you have to be a certified pharmacy technician.
There's an important distinction.
That's all part of this. That's all part of the licensing and registration. In order to be a qualified pharmacy technician, in order to get that coverage and the liability immunity, not only do you have to meet all these other requirements that have been flashing on your screen, but that as well.
So Dr. William Riccardi had the same question in our chat box. Really, he was giving an example of New York does not yet recognize technicians. So what you're saying, Elisa, is that in New York, for example, the techs would need to be certified pharmacy technicians and have obtained certification before they can be covered.
Yeah, that's what HHS included in their notification about this authority.
Okay, I got you. That's great. And is there any kind of national licensure requirement? That's not what's intended here, right? It's just certification, either through PTCB or some other accredited technician.
Yeah, or you have to meet the requirements of your state if the state does have licensing and registration requirements.
Okay, all right, great. All right, got a question here from Dr. John Frazette, F-R-A-Z-Z-E-T-T-E. The staff's going to unmute your line, John, and let you ask your question. Okay, well, we're not hearing John, so I'll ask his question for him. Should a technician be able to identify the patient that needs the vaccination, or is this considered a clinical decision?
Yeah,
Kim?
so good question. So I think it's a pretty common practice we see in community pharmacy where a patient will come up and say, I want to get a flu shot today, I want to get a pneumococcal shot today, or that at some point it may be a technician asking them either at the in window or when they're picking up, have you been immunized before? So I think it's still absolutely appropriate for a technician to do that, but it is the pharmacist's job to make sure that that vaccine is appropriate for that patient. That is still 100% in the requirements of things that pharmacists will be doing with this. So I would say that that is a question that should be directed right to the pharmacist.
Okay. Kim, another question for you from pharmacist Sandy Shabbat. When a pharmacy technician is administering a vaccine, will the pharmacist check the dose the tech pulls up before it's administered? And then the same thing about being reconstituted. Generally, does the pharmacist check that step? Is there a verification step that physically happens? Kim, what do you teach on that? And Arlinda, what do you see actually happen in practice relative to that?
Sure. So we absolutely teach that the pharmacist should be checking this prescription just like they would any other prescription. So they should be looking at, here's the vial the dose was drawn out of. They should be looking at the quantity that was drawn up, making sure that all of that was appropriate. So I would say absolutely the pharmacist should be checking every bit of that, reconstituted or otherwise.
Arlinda, that's, I'm sure, what you're seeing happen there at IHS as well, that your pharmacists are checking all of that.
Oh yeah, we draw it up, and then before I administer, I just tell them this is for this vial's for this one, this one's for that one. But before I toss anything away, they just make sure to verify the VIN number and the lot number and aspirations properly written on the paper before I go see the patient.
Yeah, so the extra step that's here is you've actually, the uniqueness of this whole process is that you've got a pharmacist prescribing, technician drawing up doses and preparing the dose for the patient, the pharmacist then checking the dispensing process, and the technician administering. So there's that one extra step at the beginning where a pharmacist is prescribing, and a new step at the end where someone else is administering and the pharmacist is supervising or overseeing. So it is a different workflow, just a little bit different workflow here for the way we're moving through. Okay, I've got a couple questions that have nothing to do about technicians, and I'm going to get those questions in as well. We received a question prior to the show, and I'm going to ask Dan Zlot to answer this one. And I'm going to just admit to the audience that this Southern accented dude cannot pronounce some of these very complicated names of drugs that are coming onto the market now. So please forgive me. This week, the FDA announced approval of a new antibody treatment, bamlanivimab. That is a product from Eli Lilly. Can you tell us about the therapeutics and the dissemination strategy for this particular new drug? It was just announced this week. Dan?
Yeah, absolutely. So bamlanivimab, great job on that, Michael, is a monoclonal antibody drug against COVID-19, against the COVID-19 virus. And so let me first cover the clinical data, and then I'll move into the distribution. So this drug was studied in a phase 2 trial. They were looking at a few different doses, 700 milligrams, 2,800 milligrams, and 7,000 milligrams. And what became pretty apparent is that there really wasn't a lot of difference between the outcomes for the dose levels. So in order to make the most drug available to the most people, they went with the lowest dose. Right now, especially with monoclonal antibodies, production is always a challenge. So 700 milligrams is the dose that was selected. The outcomes that they were studying, the primary outcome here was actually looking at virologic clearance. So how well the antibody helped people clear the virus. And interestingly enough, if you look at the data, except for that highest dose, there really wasn't a statistically significant difference in the rates of viral clearance between the people who got drug and people who got placebo. So right off the bat, that sounds like a failure. However, what was really important is that people who got the drug actually were able to avoid longer stays in hospitals. So they were discharged from hospitals earlier, and they had lower rates of hospital admission and lower symptom scores. So even though it didn't do as well as we hoped at helping people clear virus, it helped them avoid being in the hospital, and it helped decrease their symptom burden more rapidly. So that's where the value of this drug lies. Now, interestingly enough, the patient population here is a little bit selected. So this is not for all comers. This is specifically targeted, if you look at the patients who are included in the trial and the patients who derive the most benefit, were patients who are at high risk of being hospitalized from COVID-19. And so we've learned a lot about what those risk factors are over the course of the COVID pandemic. So those are people who are obese, people who are immunosuppressed, people who are taking immunosuppressant drugs, people who are older, who have heart disease, diabetes, other cardiovascular risks, et cetera. So that's the patient population here who is eligible to receive this drug. And that is reflected in the emergency use authorization that the FDA issued. And so that's part of what needs to be reviewed with the patient. There's a specific handout that goes over all of this that needs to be reviewed. So that's a high-level overview of the therapeutic efficacy and the patients who are eligible for this. Let's talk a little bit now about distribution. So one of the key things, given that there's a limited supply of this drug, is we want to ensure that there's equitable distribution of this. And a huge thank you to Meg Frater, who collected this information from the Operation Warp Speed working group. And so they really did a lot of, they learned a lot through the distribution of remdesivir, and that's really sort of what we're working on here, that similar model. So the way this is going to work is the federal government is going to look at hospitalization trends and case trends over the last 7 days and decide who needs the drug most. And so that's based on both a temporal need as well as a geographic need. And then the federal government is going to direct a supply to the states. From there, the states will decide who locally gets that drug. So they'll direct it to counties, to specific parishes, smaller groups of geographic regions. And then from there, that will go specifically to hospitals. Now, the drug isn't actually being passed along to each of these different groups. It's handled by a distributor coming directly from the manufacturer, but the allocations that each group gets is being decided by the federal government and then the state government, and that's being directed towards the hospitals. And then the actual deliverer, or the middleman who handles the logistics of delivering the medication, will then get that to the patient. Now, a couple other logistical things. This is an IV infusion, and so it's not something that anybody can do. You need a little bit of extra setup. You need to have people who are trained in IV infusions. You need to have an area to prepare IV infusions. It does require some IV admixture. And you also need to have a setup in order to watch patients during and after the infusion and be able to respond to emergency reactions. Safety of this medication was really good. There were no serious adverse events reported in the phase 2 trial. There were some pretty common infusion reactions that you see. They were all mild in nature. And so those include things like redness, pruritus, facial swelling, but again, very mild in nature and reversible. So a couple other logistical things about this particular medication. So there's bamlanivimab in a nutshell.
That's great. We'll just call it BAM. How about that? That makes good sense. Now we know we're up to speed on this one. So thank you for that, Dan. I want to unmute the line of Kirat Siraj. Kirat Siraj, we're unmuting your line and let you ask your question. Okay, not hearing anybody. The question here is there any evidence about the new strains of COVID that would be unable to be detected in possible testing techniques? I think the question here is about COVID mutation. And Dan, I think maybe you're the guy to answer this question as well. Are we concerned about COVID mutation and being undetectable with the new testing that's out there?
Yeah, that's a really interesting and fascinating question, and one that we really, to my knowledge, don't have a lot of data about. That said, there's a few different ways that could potentially happen. So as the virus mutates, when you think about the different testing modalities, right, there are RNA-based tests, our PCR-based tests. There are antigen-based tests. So those are sort of the two main modalities. And so if there were a mutation that affected the RNA that our probe sequence was looking for in the PCR-based tests, it's possible that someone could have COVID, but that would escape detection. I don't know that that's been reported. Likewise, for the antigen-based tests, those are using generally antibodies against the different pieces of the COVID-19 virus. So again, if the mutation were just right, that it changed the conformation of the proteins so that the antibodies being used to detect those proteins couldn't recognize them, again, it's possible someone could have COVID, but the test would not be able to recognize it. Again, to my knowledge, that has not been reported in the literature, but it is possible.
Yeah, okay. Next question is going to go to Mitch Rotholtz. Another piece of news from yesterday. Yesterday, Pfizer announced that they plan to submit their emergency use authorization to the FDA for their vaccine tomorrow. That Friday will be the date they'll submit their EUA application to the FDA. So we're anticipating that coming. So let's assume, Mitch, that the Pfizer vaccine is approved by the FDA under emergency use authorization within the next week or so. What is the anticipated length of time that we should expect before we'll actually see Pfizer's vaccine, in this case, come to the market?
Good question, Michael. I wish I had the crystal ball to nail it down, but expectations are that the committees that have to do the review are going to do their due diligence, and the timeline that I've heard this past week was in 2 to 3 weeks that we should have the first approval for a vaccine coming out. Just to remind everybody, it's got to go through the FDA committee. Once it goes through the FDA committee in terms of the EUA, it then goes over to the CDC ACIP to then make the final recommendation, and then that will then put in motion the distribution of the vaccine to appropriate targeted populations.
Okay, and Mitch, a follow-up question to that from Darla Bodner. She said, do you have any insight you can share on how non-Medicare COVID vaccinations will actually be billed? I mean, my understanding is the federal government's purchasing all the first doses and that they'll be free to all patients, but how will pharmacists bill administration fees? How's that going to work?
Some of it we know, some of it we're still waiting to hear further information from the different parties. CMS did release guidance on coverage of the administration fee for the vaccine. So for Medicare, there is a fee schedule that has been identified where you'll be getting reimbursed for the first dose at one level, which is about 16 something, and for the second dose will be 28 something. So for both the Pfizer and the Moderna vaccine, they've set up compensation schedule for that. There are also CPT codes that the AMA has adopted for coding and billing for the vaccines. So that's in place. And in terms of the guidance from CMS, they gave guidance to both the Medicaid programs as well as the private sector programs, encouraging adherence to the schedule that they're using for the Medicare population. And so we're now just waiting to see how both the state and the private sector take that and move forward. But again, they've got mechanisms for payment for the administration. Vaccine won't cost anybody anything, and that you can't charge a patient if they can't pay the administration fee. And so therefore, there's another program for somebody who doesn't have insurance or underinsured through HRSA that's being set up as well.
So I'd like to point out to our listeners that APHA on our website at pharmacists.com in the practice resources section does have resources available about billing and coding for COVID vaccines, and we continually update that information as we have more details made available to us. So please remember to go to pharmacists.com under the COVID-19 resources. Mitch, before we let you go, one last question here about vaccine. This is a little bit of a logistics question that Casey Villauer has asked, and that is, you know, if you're doing clinics outside of the pharmacy for COVID-19, I mean, obviously the first patients that come through will have never received a vaccine, so we'll know they're not immunized. But, you know, how can you do distant site clinics for second doses and so forth on these 2-dose series vaccines if you don't have access to the patient's immunization status, the IIS? Does the feds have any kind of a recommendation of mobile tracking so that you can track a person's immunization status, which product they received, and so forth for follow-up vaccination?
There are some mobile products that are being looked at. I'm not sure where they are in availability and access. That's been done with some of the state jurisdictions as well. But there will be administration cards in the kits that will be sent along with the vaccine. And so definitely giving the patient that card, asking for that card will be one mechanism. In terms of having access to the IIS systems, that's something I think that each jurisdiction is looking at right now.
Yeah, that's great. Well, Kim, Arlinda, thank you for joining us today as our guests on the show. Mitch, thanks for being one of our experts today. We do have a lot more questions in the question box. I'm going to address a couple of them real quickly before we turn the program over to APHA staff to share some information with you. One of the questions that came today was about the COVID test that has just been approved for at-home use. And you probably have heard about this in the news. There was a test that was approved. Does this mean that pharmacists can order this test, COVID test, for their patients? And Elisa, before you jump into the association information, could you tell us, can pharmacists prescribe this test? Because it said on the news that FDA had authorized an at-home test by prescription only. Can the pharmacist prescribe that test?
Yes, but there are some strings attached, and that is that they either have to be they have to meet the requirements in the authorization that HHS provided. Though for the most part, if it's a test that's COVID, and it's authorized by FDA or approved by FDA or some other way licensed, then it is covered under the authority.
Okay, that's great. And one other thing that I wanted to address that was, let me see here. We've got lots of questions, and I'm wanting to try to meet both. Oh, one that I'll answer today. Cynthia Willette asked a question about when the COVID vaccine comes out. For the vaccines that are 2 doses, do we have any information about how effective the vaccines are after only one dose. And what I would say to you, Cynthia, is stay tuned on this, because as the data is submitted by Pfizer and Moderna to the FDA for their EUA, they will share that information as a part of their EUA application. I can tell you that in the phase 2 trials that were used to get to phase 3, it was only about 18% of people seroconverted or developed antibodies after the first dose. So that second dose is really going to be critical, we think. Now we have to wait and see what the data says when the EUA is finally submitted, and we'll know a lot more tomorrow about this. But I think the answer here is it's going to really be critical that people get 2 doses for the vaccines that are dosed in a 2-dose series. So with that, if we didn't get to your question today during the show, we'll do our best to answer those questions on the Engage platform for COVID-19 at pharmacist.com. Right now, I want to turn it over, however, to Elisa Bernstein, who's going to share some more current and late-breaking information on the regulatory front in Washington.
Great, thank you. Gosh, I continue to learn more and more on these webinars, so this is great. I'm glad that I'm kind of forced to be here since I work for APhA. Anyway, so what I wanted to share is a couple of things that happened since the last time we met. HHS announced recently that they expanded the number of pharmacies that are going to get direct distribution from the government under a new federal partnership strategy for COVID-19 vaccination. So we heard before a couple of weeks ago that the government announced their partnership with some very large chains. What this does is it actually broadens the number of pharmacies that will be included in that program, and includes the networks of independent pharmacies as well as regional chains as well. So it won't include all pharmacies, and if your pharmacy is not part of one of these networks, then you are highly encouraged to work with the state to coordinate with state public health departments in order to become a COVID vaccine provider. And there are requirements that go along with being a COVID vaccine provider, but HHS is relying on pharmacy. They're working really hard to make it easy for pharmacists who are accessible points in the community across the country to jump in and be part of the solution and the response to immunize the country. So if you have any questions on that, you know, our government affairs team at APhA is more than happy to answer any questions that you have. So this was really good news. So it expands the breadth of that direct federal distribution. If you can go to the next slide, please. Also in the last week, or at least this is something we hear in the coming week, sometime maybe this week or next. If you recall, we told you about, and you probably read about, the president has issued several executive orders related to drug pricing. And we hear that in the next very near future, 2 regulations will be coming out. One is related to most favored nation pricing for Medicare. So this would be a regulation that tags the price of the drug to the lowest price in other countries. There was a lot of pushback about this program and policy, and it sounds like that this administration is about to issue a regulation for this. The other regulation that we hear is coming out very shortly is the rebate rule. So this is a rule that will be a final regulation that would prohibit PBMs from retaining the rebates from drug manufacturers. And the idea is it would lower the cost to beneficiaries that at the pharmacy counter. How that impacts pharmacy, whether or not it includes DIR reform or something about that, we don't know, but we're standing on guard to check that out as soon as they publish and review it and get information to you. If you could go to the next slide. So this is just following up from today's really great discussion. We have a number of, on APHA's website, a number of pharmacy technician resources. So please go to our website if you have any, if you want any information for whether you're a pharmacist or a pharmacy tech. There's loads of information, particularly about how to become a certified pharmacy technician and some exam materials. So I will go to the next slide, looking at the time here. And again, we continue to offer at APHA a number of COVID-related continuing education information. Go to our website. We have a couple that are coming up, as well as the recorded versions of previous episodes on our website. Thank you. Back to you.
Thanks, Elisa. And I want to get our audience to chime in here. We have a polling question for you. We would like to know currently how engaged pharmacy technicians are in your practice, specifically related to vaccines. Are pharmacy technicians in your practice actively administering vaccines now? Do you have training in process? Or are you planning to complete training, or are you not planning to have technicians administer vaccines in your practice? Could you just take a few seconds and click the answer that you have on the screen there so we can get a little feedback from you? We're curious as about what's going on in practice, and your feedback here would be great. Just take a few moments and again, give us your response. I know many of you are already voting. Thank you so much for your speedy clicking. All right, let's take a look here at the results of our poll. And it looks like about 65% currently don't plan to have your pharmacy technicians involved in training. To about almost 20% are planning to complete training, and others are in various earlier stages of the process. So thank you for your response on that. I do want to remind everybody that our Engage platform is an opportunity for APHA members to share information with each other. And our Engage platform is very active with people having conversations about what's going on during the COVID crisis, and we invite you to join that as well. If you're not an APHA member, please do take time to join us. We need your support to help us continue fighting for our profession and doing the great things to advance patient care through pharmacist services. Now, next week is Thanksgiving week, and we're thankful for many things in our lives, and we hope that you celebrate Thanksgiving in a way that's appropriate for you and your family. We will not have a webinar next week as a result of that. I do want to let you know that our December 3rd and December 10th webinars are going to be breaking news about COVID vaccines, and you will not want to miss it, because there is so much that we know is going to happen beginning this afternoon and going for the next 2 weeks about COVID vaccines, that the information is going to be coming very rapidly. You will not want to miss. Go ahead and tell your friends that are pharmacists, especially, to put this on their calendars, 1 to 2 p.m. Eastern time, December 3rd and December 10th, the next 2 weeks following Thanksgiving, as we really give you the nitty-gritty, late-breaking information about implementation of COVID-19 vaccine into your practice. There's going to be a lot happening quick, folks, and we want to make sure that you have the latest information. Now, as we finish our webinar this week and we think about all of the things that we are thankful for, we are thankful for you. We're thankful for what you do in your communities. But we also realize that our nation has crossed a major threshold this week of 250,000 people who have died from coronavirus. This is a sobering moment in our nation and in our world's history, really. And we do know that there are many pharmacists, pharmacy technicians, and even some student pharmacists who've lost their lives in their attempt to fight coronavirus, who've contracted coronavirus themselves and have died. And so to end today's webinar, we would like to end the webinar with a moment of silence in memory and in honor of those who have perished in our profession. Please join me in a moment of silence. Thank you.